Namaste and welcome. Is the third wave upon us? Are we just counting down to it? And how much will getting the jab help us? Here at Network 18, we believe that the jab, the dose, the vaccine against COVID 19 is the shot of life. And with us are our partners, Federal Bank, and of course, our health partners, Apollo 24/7, and our NGO partners, United Way Mumbai. And our endeavor has been to spread this message of vaccine awareness. Anybody and everybody we are meeting, and also across the network, our message is singular: go get the jab, go get vaccinated, because it will and it can save your life. Let's talk about the third wave and can vaccine change the tide? And joining us today on this discourse over the course of the next half hour are Padma Shri Dr. Sanjeev Bagai, Chairman and MD Nephron Clinic, New Delhi. We also have Dr. Rajesh Chawla, Senior Consultant Pulmonology and Critical Care, Indraprastha Apollo Hospitals, New Delhi, and Dr. Vinny Kantroo, who's the Senior Consultant Pulmonology and Respiratory Medicine, again at Indraprastha Apollo Hospitals, New Delhi. Namaste to all of you. Thank you very, very much. And the recent surge in the vaccination doses is very encouraging. Even the second dose, we are averaging about 1 million doses per day, which is very encouraging. But Dr. Sanjeev Bagai, there are now many more studies, and every day there are more studies coming through, which only corroborate that getting the jab can save your life, especially against COVID-19.
Absolutely. There is no question about it. There is unequivocal evidence to show that vaccines saves lives. Now, we are dealing with two eras. One is what we call as the pre-Delta era, and the second is called as the post-Delta era. In the pre-Delta era, we were mainly dealing with the Alpha strain, and in the post-Delta era, we are now dealing with the Delta strain. Without going into the micro details of the Delta strain, which is obviously more infectious, more invasive, quicker transmission and quicker replication, we've seen some amount of decrease in the response as far as the effectiveness is concerned in multiple studies internationally. There are 47 studies internationally, out of which 9 have had meta-analysis in which the overall collaborative data shows that the effectiveness has dipped in some studies from 95 now to 56. Therefore, Israel, in fact, has just published data. The Ministry of Health of Israel has just published data this morning, which has shown that the booster jab has increased the effectiveness of the vaccine from 44% up to 88%, decreasing the death rate by 4.4% and decreasing the hospitalization and ICU admissions by 8.2%. But both the Indian vaccines are working very well. We've had the initial results from the ICMR a couple of months back, which has shown the breakthrough infection rate to be only 0.02 to 0.03%. Undisputedly, both the platforms of the Indian vaccines have been very good, and they've saved perhaps more than hundreds and thousands of lives. What is extremely important, I must add, the vaccines will do their part, but the masks are perpetually going to be our DNA. I've said this on many platforms: the virus is an RNA, but our DNA has to be our mask. And there are 4 multi-pronged studies which have shown why masks are extremely important, along as important, if not more, than the vaccine. One is that as far as the masks are concerned, especially in the Delta variant, in the first 2 days, in the first 1.8 days, 76% of transmission already takes place without a person having symptoms. Therefore, masks are important. Point number 2, masks stop the viral RNA transmission up to 77%. Point number 3, and even more important, is that masks, 68% of people, in spite of 2 vaccines, continue to have nasal carriage of the RNA. So the masks are going to stop the spread, stop the chain of transmission, so to say. So vaccines and masks are, for the better part of this year, going to save many, many lives.
Absolutely. And the other aspect is that we are crossing more than 56 crore vaccines, nearing 57 crore vaccines. That is first jabs. And the second jabs, also about 13% of the overall eligible group has got the second dose. But most importantly, Dr. Chawla, what we are seeing is that the overall caseload in our country was about 3 crores, 3.5 crores. But the vaccines, the number of people who've got vaccines and those who may have got asymptomatically, who may have contracted the virus, and overall, are we getting closer to a certain level of herd immunity? And because of which, perhaps the third wave may be minor ripples across states rather than what we saw in the devastating second wave. Would you agree or disagree?
Zero survey has already shown that even in the city of Delhi, more than 70% people had positive antibodies. So definitely, as you know, today only 25 new cases were reported in the city of Delhi. It is not possible unless there is a significant herd immunity, and a lot of people have contracted this infection. And in the last about since January, a lot of people have got vaccinated. And I think this is a good thing. Like Dr. Bagai has also said, the two things which we can save us is the vaccination at an even faster speed, and probably the second thing is a mask. Whatever we say, I think these two messages, if you have not been vaccinated, please get vaccinated yourself. Forget about the efficacy, forget about your what you see around and what you see in media. It is effective. As of today, the vaccine is effective in preventing the spread of infection. Of course, whether booster is required or not, with time we will know, and you can always take booster. But right now, at least get your first jab, and then after a month, second jab. Although you keep on hearing that the efficacy of Pfizer vaccine and the Covishield is little less. It wanes off against the Delta variant, but still you get it because this process follows a certain kind of epidemiology. If you get the vaccine, if you wear the mask, probably we may not see the third wave. Otherwise, you are seeing in Kerala and certain part of India, still the numbers are not falling down. And we don't want a scene like what we had seen in the second wave in the bigger cities. So these two things we have to talk repeatedly, and we have to go for it. If any one of you is, please go and get vaccinated if you not got your jab till now.
True, and somewhere, Dr. Kantroo, even at the Indraprastha Apollo Hospitals, you guys did a study with the health workers, those who were vaccinated and those who were not, and there was a significant drop in the acuteness or the severity of the virus itself. That perhaps is the most critical aspect, that you may still contract the virus, but you may not need the kind of levels of oxygen supply or hospital beds and hospitalization that was required perhaps had you not got the vaccine. And that's what perhaps is a difference today.
Yes, definitely, Anand. I would like to reiterate the fact that vaccination is absolutely important, as stated by Dr. Bagai. He has given us all the important figures. We at our center in Indraprastha Apollo Hospitals did do a study where we found out that the number of people who were getting severe or critical COVID-19 and required any form of respiratory support, intensive care, or oxygen was absolutely less as compared to the ones who were actually mild cases. So there was a significant drop in the number of people who got severe COVID-19 disease. So this is a fact now which has been proven not only in this part of the world but all over the world, with studies which you keep in front of you and see the larger frame. You will see that vaccination is absolutely critical at this point, to prevent COVID-19 from causing a third wave actually. So we do need to get down these numbers, these acute surges in the number of cases which happen with a new strain. Even if they come in, we need to tackle with them in form of vaccination, which is going to prevent the severe and critical COVID-19 disease. So we might think in terms of the fact that rural people generally feel they are more healthier than the urban dwellers. They do think in terms of being exposed to better environment. They do think they eat healthier, and their bodies have never had any previous diseases. But I should reiterate the fact that these people are also susceptible to this virus, which is completely new and actually can involve any and every organ of your body. So this message has actually, it has to reach that strata of people who still have certain kind of vaccine hesitancy at the moment, and these should be the ones who should at once go and get themselves vaccinated against COVID 19. That is what is going to be critical to prevent the third wave of COVID 19, as we all know from the facts and the studies which have been carried out.
True, because through Sanjeevani, we've realized, and the NGO partners have come out and said that initially there was a lot of resistance in the rural areas, in the districts. When you get into the tier two, tier three cities, and when you're getting into the villages, our task was to go across to about 500 villages. But then the turnaround was also very fast, that those who were vaccine resistant or hesitant became vaccine champions the moment they saw the benefits, the moment they saw somebody getting the vaccine and then doing well, and then being able to get about doing their go about their duties normally, or even if they did contract COVID, getting off it like a mild flu and not getting it severely done, the conviction has now improved, and that's what many of our NGO partners through across the districts and across 5 states have said, that now it's more of the local people. Once they've seen, then they are now becoming champions, and many people are getting the jab thinking that they can get back to their lives, they can get back on, with work, going to work, and continuing their pursuits as far as employment and other activities which were perhaps the normal for them pre-COVID times. But Dr. Kantru, let me ask you this: do different nations behave differently? And because we have a history of vaccination, do you think we are a little more resistant to this virus compared to other nations?
See, I wouldn't say that we have behaved in any different manner as compared to people in other part of the world. The fact of the matter is that this virus has actually jumped species. It has occurred in the bats, and it is now causing the disease in human beings. So even if we are exposed to many number of diseases right from our childhood, which includes the digestive system viruses and also various respiratory viral diseases, but we do not have any kind of immunity against a virus which is the COVID 19, which is completely new for our body. So do not think, even if you have very robust bodies, you are healthy, your lifestyle is healthy, this virus is not going to be affecting you. But yes, the fact of the matter is that if you have certain comorbidities, if you have certain diseases, for example, you have diabetes, you have hypertension, you have cardiac diseases, you have kidney affections, you have any immunocompromised state, but these are well controlled, then you are going to be the one where COVID 19 is not going to cause so much of problem as compared to people who have uncontrolled comorbidities, especially diabetes. So we have a lot of studies now which do prove that if somebody is having these n number of diseases and their lifestyle is very unhealthy, then yes, COVID 19 is going to be very critical and severe in these kind of people. So now we have to think in terms of way forward by incorporating physical activity right from a very early age and teach our youngsters that physical activity is absolutely essential. Because of the lockdown happening, there are a lot of instances where the pandemic of obesity is now causing a lot of issues. The children are home, they are having online classes, they have to do online classes, their screen time is quite high, and everybody is facing a lot of issues in terms of physical activity and gain in weight. So yes, we have to take out our sports shoes and get back into a mode where we are incorporating very healthy lifestyles in our daily routine. So yes, these are some of the things which are going to help you.
Yes, you talked about child obesity or the pandemic of obesity, and that is something which many doctors have said, and they're very startled because this is also triggering certain biological functions among kids far before they should actually be triggered within them, and this is also an issue that's come to the fore. But like I tell everybody, 10,000 steps. You got to count your steps, and you got to count up to 10,000 every day, and you got to make that happen, because otherwise your lungs are not going to be open and your body is not going to be fit enough to be able to fight. But one thing, Dr. Chawla, every nation seems to be behaving differently. Now, in India, how do you say, is the second wave over? And how would you read the onset of a third wave? Because nations like Brazil, nations like America, Israel, everybody, Australia, they've all behaved very differently, the UK. So how do we read and say, okay, this is the onset of the third wave, this is third wave, second wave, khatam ho gaya. Is there a point or is there a trend?
When the third wave comes, you will know without any problem. The number of cases, they just rise so exponentially. It took 10 days for us to realize that we are in the midst of a second wave.
Yeah.
And the definitely the second wave is subsiding. This glaring example, if you see the city of Delhi, the cases which were in thousands, now they've dropped down just below 50, 25, and only 2 deaths today. So the second wave definitely is weaning off. I mean, it will disappear, and probably I hope that if the herd immunity in the city of Delhi, probably we know more about the city where we stay, that and if it is behaving, all other places are going to behave similarly. I'm really surprised at the way Kerala is behaving. The number of
Yeah.
cases are not coming down, and that really worries me, because second wave, first we had cases in the Kerala, then Mumbai, and then rather it started from UK, and then Mumbai, and Kerala, and then Delhi and other part of India. They just took over. Probably now, I'm quite sure the third wave is not going to be that heavy like a second wave. It might come, it might not come. If you all get vaccinated, if we all are careful, if we all wear masks, this is not going to come. If it comes, it will be very mild. And that's what I hope. And I'm quite sure it is going to behave, because another 2, 3 months if pass and we got saving, there is no big mutation, because we had alpha, then beta, then delta, and then in some places in the world we have lambda also.
Yeah.
So if the mutation doesn't occur, people behave properly, we get vaccinated, probably the third wave we can avoid, or it will be very, very mild. That's what I think.
So we'll see if the cases spike. But the other aspect is, if cases spike, but recoveries are also faster. In Kerala, one aspect that you're seeing is Kerala is saying that we're not running out of beds. We don't have oxygen shortage. We don't have patients thronging hospitals, Dr. Bagai. So is Kerala witnessing a kind of a surge where people are getting the flu, but they're not contracting it as acutely as they would earlier?
Yeah. So well, let me just rewind just for a fleeting second onto this entire aspect of this herd immunity. Now, herd immunity overall worldwide actually is now fading away as a phrase. I think it's very difficult to define and designate herd immunity as a percentage, because the situation is so evolving in such a dynamic speed. But having said that, there is going to be community acquired immunity, and for 6 simple reasons. To enumerate them very quickly, there is something which is known as a human coronavirus's cross immunity. So there are 4 other human coronaviruses which we call as common cold viruses, which give cross immunity to the SARS-CoV-2, what we are seeing as COVID-19. Point number 2, there is something known as protein to protein crosstalk. So there are a lot of other viruses which are non-coronaviruses which also are giving cross immunity and protection towards SARS-CoV-2. Point number 3 is there is something which we call as the people who already got infected. So they are going to be carrying what we call as a latent immunity. They have recovered, their antibodies may be down, but they are still carrying a latent immunity. And that immunity doesn't necessarily correlate to your neutralizing antibodies, but it's more important because of a variety of T cell responses, which is a cellular response. And coming to the cellular response, the most important part to give you long-term community-acquired immunity is the memory T cells and the memory B cells. That's your bank. That's something which actually helps you later on, helps you to recognize the infection. Now, coming to Kerala as an index case, I think it's very good that we are not seeing a huge amount of critical cases which require hospitalization and ICUs. But the important thing is that worldwide, more than 51% of patients are actually in a meta-analysis Cochrane trial shown to have asymptomatic disease. That's mild disease. But 30% of these asymptomatic carriers at the end of 12 weeks and going up to at the end of 6 months are going to land up with long COVID. This is worldwide data of millions of patients. So I think I'm not happy just saying that it is asymptomatic patients or mild patients and we have not been overburdened by the hospitalization rates. That's very good in one manner. But I would like to see overall infection being controlled, because as long as this bushfire is simmering somewhere, it can ignite and catch speed again in any part of India. No state is safe till all the states are safe. So I think it's extremely important that COVID appropriate behavior is actually becoming now a cornerstone, because no graph can be intuitive, because human behavior is unpredictable. So we have to make sure that the super spreader events do not ever happen, at least in this part of the year. We do not remove our mask, we keep our social distancing, and we make sure that we become vaccine champions and ambassadors. Undoubtedly, the vaccines are going to help. There is a lot of data which has shown that there is a waning immunity with regards to the neutralizing antibodies. I don't want anyone to buy into that. The neutralizing antibodies are not going to give you a complete picture. I again reiterate, it's the T cell response and the regulator T cells and the follicular helper T cells which are much more important, and they do give you a much longer lasting immunity. They will prevent serious infections, they will prevent hospitalizations, indeed they will prevent death. Vaccination and masks, and you will live.
Yeah, I agree. And I think everybody is saying it, but somewhere the masks become a pain, isn't it? Masks are also a bit of a challenge to try become an irritant, and everybody wants to get rid of it. But the fact is that till the time we are totally rid of COVID-19, we also cannot get rid of the mask. But the other thing is, because of these health protocols, Dr. Chawla, people are not contracting many other diseases too. So a lot of the other communicable and far more morbid diseases are people are being saved because of that, because of these health protocols that we are following because of COVID-19.
It is absolutely right. Every year we get a lot of patients who come in acute attack of asthma or COPD getting worse. The number of patients who are getting worse is less. If you talk to your department of neurology, the neurologist, they say even the strokes are less. See, a lot of the people are not exposed to pollution, particularly the metro cities. I mean, they are not exposed to a lot of other things, and they are remaining indoors. They are not indulging in a lot of things which they normally do. The trauma is less. The lot of diseases, particularly the respiratory diseases, are less. Neurological diseases are less, and even some the cardiac diseases are also less. But this also shows that if you take care of you well and you follow properly, you not only avoid the COVID-19, you avoid other things also. In cities like or countries like Japan and China, people wear otherwise also these masks.
Yeah.
And probably in the coming years, a lot of people are voluntarily going to put masks to avoid these things, particularly where there is a more pollution. And there is no harm of wearing a mask. It will avoid a lot of other things as well.
True, I agree. But somewhere, wearing a mask can also be a little bit of a frustration. When we talk about frustration, while some of the more communicable diseases are on the wane or there is a marked down, that's what many experts say. But Dr. Kantroo, some of the other issues that some you touched upon are also on the high. There is a certain level of mental fatigue and mental stress that's coming through eating habits, and because of a sedentary lifestyle, because of being at home, those are also issues that we need to watch out for. And somewhere, this also perhaps lowers our resistance to an illness, or how we would deal with if we got the illness. मान लीजिए somebody has locked themselves for the last 18 months and not stepped out and not contracted COVID-19. They step out and they contract it. Imagine what would happen to them. It's not easy to deal with it at that time.
So I am really happy that you have touched this issue of mental health in COVID-19 era, because this has been a huge issue not only with COVID-19 patients but also with their caregivers, their family members, and as well as with the healthcare workers who take care of these critical patients. We have had situations where people have been home thinking that they would not be ever getting COVID-19 disease, but once they got into COVID inappropriate behavior and came out of their houses with a new Delta variant coming into play, they did get infection, and in a very bad way. So COVID appropriate behavior is absolutely essential even if you're having all your vaccinations, your boosters, etc., and following a good lifestyle. So it is the mask which is going to prevent you from getting any kind of respiratory infections. The respiratory infections do go down when we wear mask towards most of the time when we are out into the crowded place. So the another fact is that with extended wearing of mask, we do have something called mask fatigue, which also leads to a lot of issues in terms of cognitive abilities, in terms of the energy levels which we have. Having this kind of fatigue while you are wearing mask, and at the end of the day when you reach your home, you're completely listless and energyless to do any kind of activity, and you do feel that you go on to sleep at once as you reach your home. So there are certain tips which need to be followed if you want to get rid of this mask fatigue. The best way is that while you are on your work, do not forget to drink a lot of water, because we have seen with the extended wearing of mask, you do tend to ignore taking enough of water during the day, which might be one of the causes that you feel listless when you reach home. So do take these oxygen breaks in between your work. Go out into an area where there are not many number of people and you're not around a crowded area. You can take out your mask, drink a lot of water, and give yourself some tea break. And also you should be practicing gratitude most of the time. We should be thankful to God that we are alive here and discussing all of these things, including us, the healthcare professionals, who have been exposed to these critical patients right from their start and have been exposed to physical ailments, suffering from COVID-19 themselves, as well as mental health issues, which can be taken care by a routine which can include meditation in your daily routine. So yes, please take care of yourself. Take out that me time every day, which will give you a refreshing thought process and help combat this kind of virus, both with a healthy lifestyle as well as healthy thinking.
Yeah, I totally agree. There are other ways also where if you're not amidst too many people and you're going to be working in an office where you're not going to be exposed to too many people for a certain period of time, like you said, you can either go out into an open space and not wear a mask, or wear some other alternative which keeps your face covered but allows you a certain flexibility in terms of breathing. And everybody finds different ways of doing it. But I just quickly want to, we've got limited time, so the final 5-7 minutes, I want to I want to get your thoughts on one point. I was speaking to somebody within the government and within policymakers. So I asked them, sir, school kab khul rahe hain? So you've had more than 55 crore people who you have vaccinated, and your surveillance is saying that majority of the people in most of the places have already got a certain level of herd immunity. We are working towards it because they've either contracted it or they're carrying antibodies. Sero surveys are all saying. So why aren't you opening up schools? So because teachers, most of them are getting vaccinated, and why aren't you opening up schools? So the response was just a single line: school खुलने से third wave आ गया तो. What if a third wave is triggered because we open schools? Because they're still looking at children as carriers. Now, where do you stand on this, Dr. Chawla? Let me start with you.
I think the fear is genuine. We all know that we still have not vaccinated the younger population. Of course, for the 12 and above, it will be started very soon, and for the younger than 12 years, it will take few months before it is started. Although it is said that a lot of the younger generation had infections and it is mainly asymptomatic, but I think they need to be quite sure before they open school. I agree with them, because there is a fear of spurt of cases if the children have not been exposed to anything. So that is not only the fear in India, it is all over the world, that if the third wave comes and the children who are not vaccinated have not been exposed to infection, the number of cases would be more there. Of course, the number maybe more, they will not be that severe because children or the younger population usually gets a milder disease. But the schools, they don't want, because the moment the number of cases increase in any of the cities, there will be lockdown. So I think they will go slow on this. That's what I feel. Till the picture becomes more clear in next 2-3 months, probably when we are quite sure that the number of cases are going down all over the cities and there is a less chance of a wave like this, and the children have been started vaccinating, that's the time I think they'll think of opening schools.
Yeah, but the studies were, and right from the beginning, everybody said that children who are under the age of 14 or 15, are least susceptible to get an acute a form of COVID-19, or really suffer, because like 1.5, 2 days they will recover. Yeah, the fear was that they may act as carriers. So बच्चों की वजह से घर के अंदर कोविड आ गया, बड़ों को हो गया तो क्या?
Yeah,
अब बड़े
that's
तो ज्यादातर everybody's got the jab. Most of them have got vaccinated. So if you're getting a critical number of people who have gotten vaccinated, so then why again hold children at home? Because one of the biggest issues, like not just about the pandemic obesity, the other aspect is cognitive growth for children. So this is a critical aspect. So do you think it's going to trigger a third wave if we open schools, Dr. Bagai?
Yeah, I think this is one of my pet topics, so to say. I'm not in favor of having the schools opened very clearly, and there is sufficient scientific reasons. I think we should not move without science, without data, and without evidence. So children are less susceptible from the nasal passage because they have a lesser representation of ACE receptors, and they have something which is very cutely known as a memory phenotype in the nose, which tends to protect them. So those are called as sensing protein patterns. But having said that, and there are a lot of names to that, but having said that, most children are obligatory mouth breathers. So then it becomes counterproductive. Now, children unfortunately produce and release 4 very peculiar hormones which are only immunophenotypically dominant in children. One is known as alarmin, second is protein, third is secretin, and the fourth one, unfortunately, is known as zumulin, which is secreted from the intestines, which breaks the intestinal barrier, and therefore the children are having a lot of gastrointestinal symptoms such as vomiting, loose motions, gastritis, abdominal pain, and cramps, and then it goes into what we call as a multisystemic disease. Now, having said that, with regards to children, there is also a recent study 2 days back which was released internationally, which is the nature.com, which has said that children not only carry the same viral load as adults, apple to apple, but it's 1.4 times more susceptible to transmit the disease. So children are great transmitters of this disease. Now, irrespective of what precautions are taken in school, schools are bound to happen as super spreader events. So I think it's important that we keep a note that these super spreader events don't happen. I think ventilation will become a challenge in the schools in spite of the masks and the social distancing. We know that there is long jump COVID. COVID is now called as fleeting COVID because it can be contracted in 15 seconds of innocent exposure. An asymptomatic carrier in the room, having visited 2 hours before, the virus as microvirons can linger in the air for 9 hours and can travel up to 60 feet. So I think children have to be dealt with very carefully. Children long COVID is twice as the number as adult long COVID. So the worst thing which you want to do is to give long COVID to children because it's devastating. Children mental health has to be paid acute attention to because we feel that only adults have depression, anxiety, fear, and so on. But I think children suffer the same. Maybe the manifestations are difficult to pick up. So I think children require special care. We should have a mix and match between a little bit of school opening, maybe after a couple of months, not immediately now, but staggered timings. And also keeping in mind that whatever can be done online should continue online. Encourage them for more outdoor activities rather than indoor classes. The weather also luckily is going to become good in the latter part of the year. So I think children need to be dealt with a little carefully. I think the overall population of India and children is largely unvaccinated. So they are the most vulnerable group. Children also have comorbidities. Almost 25% of children are either overweight or obese, which is a great forerunner as a comorbid risk condition. So I think we need to be careful as far as school opening is concerned, not just yet.
Right. So not just yet. Let 12 to 18 also start getting vaccinated, and then let's move towards that step by step. Slowly is what they're saying. In the meantime, continue to take those 10,000 steps. Make sure that you're doing it even in the confines of your house, or if you're limiting your activity, or if you're stepping out, ensure that everybody in the household does it. Final word from Dr. Kantroo, and before we wind up this conversation.
The best way to wind up this discussion is going to be stating the facts again, that vaccination is absolutely critical to prevent the hospitalizations and the severe disease as well as death from COVID-19. So this message should reach each and every corner of the country, and those who still have certain kind of vaccine hesitancy, they should get themselves vaccinated at once and prevent the third wave of COVID-19 from happening at all. So the other way is to follow COVID appropriate behavior. If you all incorporate COVID appropriate behavior into your lifestyles, we are going to go out of this pandemic and help ourselves to go back to our normal lives, both in terms of social life and our economic progress, and really help ourselves and people around us. Yes, the third thing which I want to tell and stress upon is the fact that in addition to COVID-19, do take care of your non-COVID-19 related health issues, because we did see that in the COVID times, when the acute number of patients was much more, people are hesitant to come to the hospital to get themselves checked. That might be one of the reasons that we are seeing a lot of tuberculosis patients who have come into us thinking that they had little bit of symptoms, they had low grade fever, which might not be important or related, but we did get patients already having their advanced disease in terms of tuberculosis, as well as certain cancers, which also includes lung cancer. So please do get yourselves checked if you are suffering from any kind of health related issues, and the hospitals have designated areas for non-COVID related problems, and your doctors are going to be much more helpful when you visit them early in your disease.
Well, very well said, Dr. Bagai, Dr. Chawla, and Dr. Kantroo. Thank you very, very much. Dr. Bagai, you wanted to say something? Yes, before we went.
Yeah,
Yeah.
just a quick suggestion to the policymakers and the people who make masks. I think children are not young adults, and children are not indispensable. They are 40% of the Indian population. We need appropriate size masks in the pediatric age group, at least from 3 years onwards, and we need well-fitting masks. I think the biggest problem which children face is ill-fitting masks, which are either too big or too tight. An ill-fitting mask gives you a risk of 90%, and a well-fitting mask gives you a protection of nearly 95 to 96%. So we have different sizes of pediatric equipment. I think the consumable disposable industry should also look at pediatric size masks for different age groups.
Very well, suggestion well taken, and I think we will also take it forward, and I will also make that suggestion positively, actively with those within the textile and the manufacturing industry who can consider about looking at perhaps certain kind of technical textile or a particular fiber or something which is light, which is easy to wear, which is also cool or has that bit of a cool factor which they don't mind wearing, but it will also protect. It will give you a certain kind of a microbial, bacterial, a certain amount of filter, and you get textiles today where upon contact the virus dies. So if you can get that for hospital beds and pillow covers, why can't we do it for clothing and also for masks, which children can wear and still not feel claustrophobic, still feel the fact that they can breathe and there is a certain amount of mobility for them as they do that. So suggestion very, very welcome. Dr. Bagai, Dr. Chawla, and Dr. Kantroo, wonderful having this conversation with you. Thank you very, very much.
Thank you.
Wonderful.
Thank you.
Thank you.
Namaste. Namaste.